Picture this, a place open to anyone looking to safely inject and or seek treatment for their addiction. Medical staff on site to provide sterile injection supplies, answer questions about safe injection practices, administer first aid if needed, and monitor for overdose. Crazy, right? A place where people know they are safe, but also able to seek prevention, harm reduction, and treatment interventions. These places do exist, but before discussing these safe injection sites, let's talk about our current war against drugs and why change needs to be made before more lives are taken. Opioids. The CDC defines them as natural, synthetic, or semi-synthetic chemicals that interact with opioid receptors on nerve cells in the body and in the brain, and reduces the intensity of pain signals and feelings of pain. In layman's terms, opioids are among the most illegal drugs due to their potency and highly addictive characteristics. Here are some examples of some common opioids.
Most people think of opioids, they think of heroin, but there's also Percocet, Oxycontin, morphine, methadone, and pictured here, fentanyl, a drug that is 100 times more potent than heroin.
However, some opioids are prescribed for pain relief. Some of these may look familiar, and you may not have even known that they were opioids. At the beginning of my extensive research, I remember reading the name hydrocodone as a commonly prescribed opioid. This drug sounded so familiar, and I remembered why. It was prescribed to me as a 16-year-old when I got my wisdom teeth removed. At this time, I was probably ecstatic to be given something that was so strong to cover the pain. If I, as a young teenager, was prescribed a drug so addictive for something as minimal as tooth extraction, I can only imagine what people with extensive trauma were prescribed. When I looked further into this, I learned that over 60 million people received at least one prescription for opioids last year, and that 2 million Americans are daily opioid users. The body forms physical dependencies that can only be satisfied by opioids or potent drugs that can mimic similar highs. In 2016, the CDC found that more than 11.5 million Americans reported misusing opioids. Once prescriptions are terminated, addicts who need to satisfy those cravings turn to the streets. However, the street supply for these prescription drugs does not meet the demand for those already addicted, so people are being driven towards harder to dose, cheap street drugs such as heroin and fentanyl to feed their dependency. With new prescriptions written daily and new drugs being made in the streets, the span of this epidemic is reaching new heights, and with a drug overdose rate 4 times higher in 2018 than in 1999. A harm reduction model that was first implemented in Canada but can now be seen in over 10 countries is a safe injection site, also known as supervised consumption site. Before you go off thinking that these places promote and supply drugs, is actually quite the opposite. At these sites, staff members do not directly assist in consumption or handle any drugs brought in by the clients, but are present to provide sterile injection supplies, answer questions on safe practices, administer first aid, and monitor for overdose. Overdose prevention is a primary goal of these sites. Because the onset of an overdose is rapid and waiting for an ambulance can mean death and or permanent brain damage due to the lack of oxygen, these sites are stocked with naloxone, Narcan, an overdose reversing drug. Staff members are trained on how to properly give naloxone because it has saved so many lives. According to Peter Davidson, a researcher specializing in harm reduction at the University of San Diego, no death has been reported at an injection site. Beyond just overdose, safe injection sites have many other positive impacts.
Looking into this last bullet point, saving costs due to reduction in disease, overdose deaths, and need for emergency services, I myself am an EMT. There are so many calls for overdose patients, and if there is a place such as a safe injection site where there's medical staff already on hand and able to deal with these calls, it would save so much time, and we in the ambulance would be able to better assist the community with other calls and not spend time with patients that could be assisted already.
Given that this data and information is taken from other countries, one may ask, why there are no safe injection sites currently in the US. Well, the answer is there are some people and organizations advocating for these sites to be implemented, but the majority are not. I believe it is because the general public is not being informed that this is a viable solution. I found that most critics feel as though this will just lead to more drug use and increased crime in the surrounding areas, but there's no current data to back this up. Questions are imperative when it comes to understanding things that are confusing or unfamiliar. I have some questions from the audience that were submitted before.
Delaney asks, are people allowed to walk in at their own will, or is there a process someone has to go through to be able to use the facility? Excellent question. However, anyone is allowed to use these sites. There is no prior screening in order to gain entry or access. William asks, who works and runs these clinics? Are they doctors, therapists, nurses, or are they run by private company where there is unclear of their certification? Medically trained professionals, certified peer specialists, recovery specialists, social workers, and case managers specializing in overdose prevention and harm reduction provide services. Madeline asks, how big of a role does social media play? Well, these days, social media plays a huge role in everything, and there are pros and cons to that. This initially was more on the negative side at the start, but since there have been many studies that have come out and people are in higher power supporting it, it has shown progression. Here are just a couple pictures from some social media sites that I found interesting and I wanted to show you all.
My talk that I want to address. There is so much more we must do to educate ourselves, but with what we know now, action must be taken in order to save lives and prevent further problems. Safe injection sites have already saved countless lives in other countries, but now the US must take control into their own hands. There is a solution, and safe injection sites have proven they are worth a shot. Thank you.